Good morning. Today we are here, myself, Chief Officer Public Health, Pauline Oginga, and Director Public Health, Dr. Salma, just to give a little brief on the current status of Mombasa County. We do our data review once in a while, every quarter, and we also have the fortnightly review, and we also have our Emergency Operations Center anchored within this facility that alerts us when there are cases. As we know that we are currently on the raining season in Mombasa County and the country at large, and by extension we are bound to have emergence of some diseases that are linked directly with the rainy season. One of them that is concerning us right now is the dengue fever cases that have doubled from last month. And we are trying to urge the community, as much as the public health department is trying as much as possible to come up with ways of reducing the cases. It's a collective responsibility. So we want to meet the community halfway. One of them is draining of stagnant water within homesteads. We are also emphasizing on people going for treatment in public health facilities. The signs and symptoms of dengue fever are similar to malaria, so people present with issues of fever, headache, joint aches, muscle aches. At times there's also sore throat and all that, but we emphasize that people go to the public facilities for confirmation of these cases and prompt treatment. The department is trying as much as possible to sensitize the community. We have community health volunteers moving within the community, doing the sensitizations. We have our teams, the public health officers, moving around within the community. And also we've embarked on an exercise. We are planning to start the fogging around the county, but we cannot cover the entire county. So we'll start with the informal settlement. What we are really advocating for is that during this period of time that we are doing fogging around the county, we ask the residents, because we know so many people store water in buckets and tanks, that they should cover these containers, because if they are left uncovered, they form a very good breeding site for mosquitoes. We also have a lot of tires that are idle, used tires that are around the county, and when it rains, water pool in these tires and they form a perfect breeding site for mosquitoes. So we are kindly asking those who are operating car garages or those who have tires that they've since used at home and they don't need anymore to dispose of these tires because they form perfect breeding sites for mosquitoes. We are also asking those in construction sites to remove pooling water or stagnant water within the construction sites. We've had calls coming from different residents raising concern about water pooling in certain construction sites that form perfect breeding sites for mosquitoes. In work areas, we have the mosquitoes breeding in or staying within the dark corners in the working areas. And as we know, the dengue fever mosquito bites during the day. So we also emphasize on putting on long sleeves and trousers for those who are going to workplaces, and also using mosquito repellents. But the best thing would be to fumigate these areas or spray these workstation areas to avoid workers or residents being bitten during the day. Similarly, during this rainy season, we normally have cases of diarrhea, and as a county, we've seen an upsurge in diarrheal cases. This month alone, we've seen the cases going upwards to around 8,648 throughout the county. That is a large number. We didn't have this problem 2020-2021 because people were really observing the COVID-19 measures that were going hand in hand with the hygiene aspect. But since the measures were lowered, we've seen people, the cases now coming up, and as you know, we're also moving into the flu season. So we are currently requesting residents to emphasize on the need to use safe water for drinking. We are reaching out to partners to see how we can go again and distribute aqua tabs within the community. But we also have tanks that we are distributed that people can use for safe drinking water. We also emphasize on the need on hand washing. As you know, the diarrheal cases went down during that COVID period of time because there's a lot of hand washing among the residents. So we still emphasize on the need to keep on observing these measures that came as a result of COVID, but can help us in lowering the cases of diarrhea and other kind of diseases. The positivity rate for COVID has gone up. We've moved from 0.8% to current 4.2%. And if we look at our data for 15th of this month, our positivity rate on 15th alone was around 11.5% thereabout for that one day. This means that people have relaxed so much and the cases are going up. We had all over about the warning on a fifth or sixth wave, and we can confidently say that the cases are now going up in Mombasa. What we really emphasize on is, please, can we start using the masks again? And can we wash our hands or stop shaking hands? Because people have gone back to shaking of hands. And we said, using our data last time, that when people stopped washing hands, we saw a sharp decline on communicable diseases, which means as you shake hands, there's transfer of germs from one hand to the other. So as much as the ministry said that relax some of those measures, your health is in your own hands. So we are really trying to appeal to the residents of Mombasa that since we have data that is proving that the positivity rate is going up, kindly mask up, especially in enclosed places when you're going for meetings or you're going to other places, the places that you are confined within buildings. Kindly mask up, wash your hands, and avoid shaking of hands. Similarly, on vaccination, as much as we've vaccinated more than 460,000 residents, the uptake for second dose is still low. We are at around 54%. That is quite low. Booster, we are at around 10,200 people who've gone for booster. The vaccines are there. We are grateful. We're currently having a planning meeting for RRI for Mombasa County up to the month of September. We want to increase the uptake of vaccination because we saw the numbers going down after the statement of the pronouncement that was made by the Cabinet Secretary. But we are appreciating the fact that USAID has come forward to help us in creating demand within the community and also scaling up the teams that are going out, and also we've come up with different places that we're going to reach out to increase the vaccine uptake. One of them is integration within the facilities. We are trying to see how we can integrate vaccination in our outpatient departments. This is a best practice that we picked from a sister county that has done this, and the uptake has since gone up. So we want to tap into this and take advantage and make sure that mothers who are coming for maybe antenatal care, those who are coming for outpatient services, those who are going for family planning, immunization, comprehensive care centers are vaccinated. So we'll be screening. It's not compulsory, but we emphasize on the need for protection. We are seeing those who received 2 doses being getting COVID currently. So we are worried, and we are trying to tell people, if you received 2 doses and it's beyond 6 months, kindly go for a booster. Because the people who've gone for boosters, the numbers are pretty low. So we are really emphasizing on our residents, if you received the first and second dose and it's beyond 6 months, it means the efficacy of that vaccine has gone down. Kindly come forward for booster dose to improve your immune system. So I'll pass over to my director also to say something before we have questions.
Thank you very much, Chief Officer. For me, it's to urge the community. As health sector, we cannot do this alone. We are working with other departments, MOASCO, environment, but we also need the community to play their role. As the Chief Officer has said, please, for dengue, just make sure the containers in your houses are closed. Do not leave them open, because that is where the mosquitoes are breeding. These are simple measures we can take at home and prevent some of these diseases. For diarrhea, just make sure we are drinking safe water. The issue of handshaking has been discussed. Simple messages. Our community health volunteers are coming to your households to also explain some of these measures so that we are able to contain the situation. Thank you very much.